is brought to you by Prince George's County Public Schools and Prince George's Provider Council. My name is Doralee Palamos, and I'm one of the program specialists for secondary transition. Just a little housekeeping before we get started. We want everyone to know that this session is being recorded for our families, staff, and stakeholders who want to review the webinar after attending tonight's session, and also for those who are unable to join us tonight. The recorded version of this webinar will be available within 2 business days, and it can be accessed by visiting our TY information site found on the next slide, https://tinyurl.com/PGCPS TY Fair. And then next slide, Peggy. We also wanted to let everyone know that we need to stay muted to reduce feedback and background noise. After each presentation, we will give you a few minutes to either unmute yourself in order to ask the question that you have for the guest presenter. And then we also wanted to let you know that simultaneous Spanish interpretation is available by just clicking that little globe logo found at the bottom of your Zoom control bar. Click that and then click Spanish, and then it will automatically start for you. So thank you so much for our Spanish interpreter that's with us tonight. If you're using a mobile device, at the bottom of the screen, tap the ellipsis icon on the bottom right. Tap language interpretation, and then tap Spanish. If you have any questions during the presentation, please type them in the chat box. We will be moderating the chat, and we will also have time for questions at the end of each presentation. Now, without further ado, I will turn it over to Ms. Peggy Bisanko, Prince George's County Public Schools Assistant Supervisor for Secondary Transition, for the welcome remarks.
Thank you, Doralee. And once again, welcome students, parents, family members, and guests. And thank you for joining us this evening. We are excited for you to hear from our panel of experts all about benefits for people with disabilities, especially our transitioning youth. We are also pleased to have as our moderator, Miss Melanie Clark, the Education and Community Engagement Manager for the ARC Prince George's County. Ms. Clark, the mother of a daughter with autism, has been working in the disability field for over 25 years, supporting families in navigating community resources. She has extensive experience in working with and providing workshops to both students and their families on issues related to early intervention, transitioning youth, employment, and planning for the future. Ms. Clark has coordinated several programs for the ARC, including their Benefits Enrollment Center, which educates, supports, and enrolls persons ages 18 years old and above into core disability benefits, which you will hear about this evening, and the ARC's Ready at 21 transition program, which teaches youth and parents, and often our educators, how to successfully and seamlessly move from school-based services to adult services, conducting parent workshops to engage, enlighten, and empower families who are in need of long-term support services is another area of expertise for Ms. Clark. And she has become known across the state as the resident expert on community resources and a highly sought after guest speaker. So we are extremely grateful to have Ms. Clark as our facilitator for tonight's presentation. And now Ms. Melanie Clark will introduce our panel of experts. Ms. Clark.
Awesome. Thank you so much, Peggy. It is a pleasure to be here. I believe resources are the heartbeat of transition. And our whole goal for every transitioning youth is to have a smooth, seamless transition from school to adulthood. And so I'm excited to share information tonight along with 5 other community providers that I'm going to introduce tonight. So first of all, I want to bring up my colleague at the ARC of Prince George's County, a part of our outreach and community engagement, Ms. Laquana Simmons. Ms. Simmons is our specialist for our Benefits Enrollment Center. And this center, she's going to give you more information on what the center does, but this center was brought to us from the National Council of Aging with a focus of making sure that every person in Prince George's County that is 18 years and older have the understanding of what benefits they are eligible for. So we can highlight Ms. Simmons if she can show her video and she can put
Hello.
All right.
Do you want me to share my screen?
Sure. Peggy, can she share her screen?
Or are we going to do introductions of all the panelists first?
I think I'm gonna just go ahead and have you start.
Okay.
Awesome.
Hello, everyone. I'm glad to be here. Thank you for having me. I'm going to just show share my screen here.
Awesome.
And let me get to the beginning. And so this is my name is Laquana Simmons. I'm the benefit specialist over at the ARC of Prince George's County's Benefit Enrollment Center, which is the goal or the purpose of the Benefits Enrollment Center is to enroll low-income seniors and people 18 years and older with disabilities into core benefits. And I have listed here some of you may be aware of the different benefits: Lifeline, Medicaid, food assistance, social supplemental, the LAHEAP.
All right, baby.
Got some trash. Oh, it's careful.
Hello, okay, LAHEAP,
I gotta go on to something else at 7.
DDA, and transportation.
I got you. Well,
Okay.
good now. Break a leg.
Excuse me, participants. Please put yourselves on mute if you're not presenting, because we can hear you. Thank you so much.
All right, and so the mission of as Melanie stated before, the National Council on Aging established and supports benefit enrollment centers throughout the country, and they partnered with the ARC of Prince George's County to help low-income seniors and adults with disabilities access state and federal programs that pay for healthcare, food, and more. And I just went through the list of some of the core benefits that they focus on in our area. One of the things that we want to highlight is how it works. Once you contact the ARC's Benefit Enrollment Center, our trained staff using web-based tools and person-centered approaches complete a thorough screening for you of the federal and state benefits. And then we also provide a list of local community resources. And then we put that together and we provide you a comprehensive free screening report. That guide lists all of the eligible benefits that are available to you. And we also assist with application to ensure that you can enroll in those programs. So it is a complete approach to helping those with disabilities enroll in some of these programs. And what's so vital about it is that as transitioning from that entitlement program or entitlement arena to eligibility, you aren't often aware of all of the programs that you are eligible to receive. And it's key to help find and identify these programs so that you learn what these resources are and what they can do for you. We sit down with you and right now it's virtual, we meet with you and go over these benefits and how they can help provide a more sustained and a better quality of life. So I don't want to leave this without saying it's vital that you get those linkages and become aware of what's key and available to your transitioning youth once they turn 18 years and older. give us a call. We will screen you and make you aware of what's the next step. And it, again, it's that bridge to adult services. It helps you become more aware of what's available out there to help help you with your loved one. So with that, I am really just encouraging everyone to give us a call. These are just the basics of the programs. I will skip ahead because I know we're pressed for time. Oh, one of the things I want to emphasize, this service is offered free of charge. So there is no fee attached to it. That is because the generous grant offered by the National Council on Aging provides that we can provide these reports, this information, these resources, and it is up-to-date information and resources to you free of charge, because we understand that the need here is to enroll these individuals in these programs. So with that, here is my contact information. It is lsimmons@thearchofprincegeorgescounty.org. That is our office number, and that is my cell number. So if you have any questions, please don't hesitate to call. Please do not hesitate to call me or email me at that address. So
Wonderful.
yes, and I will also drop those. This is our quarterly newsletter, as well as our clickable flyer that helps you start the process and get in touch with us. Okay.
All right. Thank you, Laquana. I encourage everyone, as a part of your transition planning, that you take note tonight what resources that you have not engaged in, and make sure that you follow up after today presentation. Email, contact the panelists so that you can make sure that you have at least a couple resources as you transition out of school that you can connect with. And for those who have another year, it's really important that you focus on that this summer. Your linkages to resources are the most important piece of the transitioning from school to adulthood. So thank you, Ms. Simmons. This was great. So let's talk about independence. We have Calvin Hawkins from Independence Now. And let me see if Calvin is, I think if Calvin can show his screen. Independence Now, Calvin, are you there? All right. I don't see your video up, but Calvin Hawkins is from Independence Now.
Yeah, please.
Oh, great. All right, Calvin, I'm glad you're here. There you go. We see your video. Yeah. Okay, wonderful. So Independence Now, a lot of families may not know what Independence Now does and how it supports transitioning youth. So Calvin, we are so excited that you are here. And can you briefly talk about Independence Now and the importance of the organization, especially as youth transition from school to adulthood?
Yes, Independence Now, we are the center that serves Prince George's and Montgomery County. We have 4 core services and a transition services. The first 4 core services, information referral. We able to refer our consumers to other agencies and help them access other services. Peer counseling is the other component of our services. Most of the time, consumers will work because of our staff. Most of our staff are persons with disabilities. So when they work one-on-one with staff, they also receive peer support and peer counseling. And also when they come into events and programs that we have, they also interact with other consumers. Advocacy, we also assist consumers with advocating, the points of advocacy, and independent living skills training. The 5th piece came in a couple of years ago, is the transition services. Is basically we focus on two populations. individuals in nursing facilities and youth transitioning from high school to adult services, which I come into play as the youth transition specialist. I assist consumers with exploring post-secondary options. Also, again, keeping, peer counseling, supporting students when they go to school to access reasonable accommodations. Addition to working with consumers one-on-one, we also have a Future Leaders Club support group that meets once a month. We meet a little bit more now, virtually. But when we get back out into the community, we'll start doing those things that we used to do in the community, like going out and to events in the community, travel training and things like that.
Awesome. Kelvin, can you talk about your youth leadership program?
Oh, the youth leadership program. Oh yeah. So again, everything's virtual now. But in the past, we have we select a group of students in high school, and they go to Townsend University for about 5 days. And what happens is they learn the importance of being able to advocate for themselves. Again, a lot of times it's the first time they're away from home, so they're able to get some experience with how it's going to be like if they choose to go to college or get their own place. And during the event, we also go to Annapolis, where they learn how a bill is developed and passed. And a couple of times we have met with the lieutenant governor and other representatives of the state. So it's a pretty big event. Again, we're having it this year, but again, like last year, it's going to be virtual. So it's really, the kids really like it.
Awesome. Are there any slots open? Or is everything filled up?
No, we have plenty. Yeah, we have some more slots available.
Okay.
I could give you the information in the chat.
Yes, if you could drop that in the chat box, and that would be excellent. And you brought up one key topic that a lot of parents often ask us. Their youth say, I want to live on my own. How does Independence Now help young adults achieve that goal?
Well, it's just to get them to start thinking about, because the kids, everybody else, I want to live on my own. I want to get out of the house. I want to get away from my parents. And the thing is, I'm like, okay, it's good to say and have ambition, but there's a lot of things going to that, like budgeting your money. I often encourage parents, if the youth, is getting money, have them, model paying rent, paying, their cell phone bills, so they can get in the habit of, what they're gonna have to do to live on their own. And so we, work on budgeting, understanding, what it's gonna take, to purchase food and things like that. But what it means to be living on your own. And we very support and really hands-on. I'm really hands-on with that. Even with the parents too. I'm very hands-on with the parents too.
Good. So for anybody who wants to start focusing on that, should they contact you to get started, get connected with a peer mentor so they can start having those discussions?
Yeah, they should definitely call me. Call me and we can discuss. And usually what happens is, if the consumer is interested, I do an intake. Again, it's going to be virtual. And once we do the intake and, the consumer identify their goals, we start working on, working on them. Again, it's sooner is better because it, as everyone knows, is a process to all these things, and um, it's time. And housing and stuff, I help them identify what housing programs that they're eligible for, and assist them with getting on those waiting lists and things like that.
All right. All right. Thank you so much, Calvin. Make sure you put your information in the chat box, because I
Okay.
think Independence Now is such a valuable organization and a great linkage for that movement from school to adulthood. So thank you so much, Calvin.
All right.
Awesome.
No problem.
So as we continue to shift from the activities and all the fun things that we were doing in school as our youth shift, we want to make sure that we do not have any gaps in the activities and the recreational and fun things that we do. That's socialization. We don't want any gaps. So I am excited to bring on Sandy Kellstrom. Sandy Kellstrom is a therapeutic recreation specialist from our favorite place, Maryland Park and Planning. We love Maryland Park and Planning. And so she's going to help us, guide us from leaving school and entering into some more fun activities as we transition. Take it away, Sandy.
Thank you so much, Melanie. It's so great to be here with so many friendly faces. As Melanie said, my name is Sandy Kellstrom. I am here representing the Maryland National Capital Park and Planning Commission, Department of Parks and Recreation, Prince George's County. I work with the Disability Services team as a Therapeutic Recreation Program Access Coordinator. The department provides specialized programs known as therapeutic recreation, and then program access, who provide disability modifications. So how many people out there want to spend your whole adult life working with no play?
Not me.
I hope everybody said no, because we all deserve a lot of we all deserve some recreation and leisure in our lives. And my personal motto is, I work hard so I can play hard. And with that, the department's slogan is, we want people to live more and play more. So when you graduate from high school, it's important to keep a healthy work-life balance. It's your choice how you want to participate in recreation. So depending on the program and your abilities, you might choose a specialized program, an inclusive program, or you may choose to participate independently. Did you know that May is National Physical Fitness and Sports Month? So how many people have been out walking the trails, out in the parks? I'm just here to say that during this whole pandemic, our parks never closed down. So there's no excuse. We need people to get out and to be active. You can view our programs at pgparks.com. And at the top of the website is a banner. And on that banner, it holds up-to-date important information. So if you click on that banner, you can see what the current May offerings are. And May registration, although it's already the 12th, we still have lots of programs that you can register for this month. And what I would do if I were you is check out the one-day ticket events. There's some free opportunities. How many people like free? So check out those free opportunities, such as the pontoon boat ride down at Patuxent River Park, which is one of my all-time favorites. So some people might be wondering about summer programs registration, which includes our day camps, our playtimes, and our virtual clubhouses. If you go to that same website, pgparks.com, and go up in the banner at the top and click on summer programs, you will see our full listing of summer day camp opportunities and playtimes, as well as our virtual clubhouses. So hopefully we have something for everyone to participate this summer. Now our programs are going to look a little bit different than they have in the past, meaning that currently we will only have 10 people in each day camp or playtime. And that means that there'll be typically 8 participants and 2 staff, depending on, that's for inclusive programming. And if you were doing a more specialized programming, it would be a higher staff to participant ratio. So if you have any questions about summer programs, please feel free to reach out to me. And I wanted to share too that if you're 21 years old and you're graduating from high school this year, just because you graduated does not mean that you can't come to summer programs. We encourage you to register and to participate like you may have in the previous years. So Melanie, I hope I'm doing okay on time, because I like to talk, and
Yes.
I know I'm still
You can
good.
share. Yeah, you can share a few more. You got a few more minutes.
Okay, great. Thank you. So we also offer adult social clubs, which are a 1-year membership. Typically, we would meet in person, but right now we're meeting virtually, and the cost is $40. For your $40, you get to meet up twice a month and do these really fun activities with lots of friends. So virtual games like Name That Tune, Family Feud. How about yoga, some paint and sip? Supplies are provided for free with your membership. It's all inclusive and mailed to your door. We hope that our trips will resume once it's safe to do so again. I know everybody misses going out and doing those fun activities. We also have a program called, the adult social clubs are for ages 21 and over. And for ages 18 to 25, we have a leisure independence training program, which currently meets virtually Monday through Thursday, 1 to 3. And it focuses on fitness, creative arts, different sports activities, cooking activities. There's so many different things happening in that program. We offer dances twice a year, our biggest social events. Everybody talks about it. It's time to get dressed up. Some people come with a date. Some people come solo. The music is the bomb. We have the Spring Fling, which is typically hosted in April, and the Holiday Hop in December. So mark your calendars early now for December. I also want to highlight that it's Mental Health Awareness Month. The Department of Parks and Recreation, in partnership with many nonprofits across the county, public and private, are hosting the virtual Chalk Art Festival. This virtual festival is being held during the entire month of May. For participants who are ages 21 and under, you are eligible to enter in a raffle to win a $10 gift card. Regardless of your age, we want you to get out and draw a picture supporting positive mental health awareness. And you can send your artwork to northern.inclusion@pgparks.com. And then last but least, hopefully we will get this back up and running again, but our volunteer opportunities, which are important to helping to build job skills for those who want to still build skills to go on and work. And I just want to put a plug in that we do have some facilities that are open now, such as our golf courses, our tennis courts, our pools by reservation only. But there are opportunities to come out and to participate with us. Thank you so much for this opportunity. Again, PG Parks, PARKS.com. Go on our website. Feel free to reach out to me as well. Thank you so much for this opportunity tonight.
Thank you, Sandy. Awesome, awesome. And so make sure everybody puts that PG Parks on their community mapping list of resources that they want to engage in, because Park and Planet has something for everyone. And so we want to make sure no one is left behind and does not have anything to do, especially this summer. All right. Thank you, Sandy. Next up, we're excited to have Kelly Nelson. She is the Outreach and Communications Manager for Merlin Able. And if you have not heard of Merlin Able, I am so glad that you are here, because we are talking about resources that we need to transition from school, and Maryland Able is one of those that you really want to learn about. We're talking about independent living, we're talking about benefits, even with the recreation, you have to have money to pay for it. So, and we'll be even talking about SSI. And so it's important to be able to protect what we have. And so Kelly is here tonight to briefly explain what Maryland Able is and the benefits of Maryland Able. Take it away, Kelly. Do you need to share your screen?
I will share my screen
Okay.
in just a minute. I just want to say thank you, Melanie, for giving me this opportunity to participate. I just appreciate all the work that you guys are at the ARC of PG County are doing, and also to the Prince George's County Public Schools for putting together this event. It's so awesome, you guys, to have a format like this where we can get together and learn a little bit about all the things that are going on for you guys as you transition out into adult life. And as Melanie said, my name is Kelly Nelson, and I'm the Outreach and Communications Manager for Maryland Able. But I also like to share with everyone that I'm also a parent. I'm a mom of a 17-year-old daughter named Lily, who has special needs. And I like to share that because in addition to knowing about ABLE accounts and how they work, I have some real life practical experience with ABLE accounts. And I've been able to see firsthand how they've helped Lily's dad and I plan and prepare for her future, and also how it's really helped Lily to build personal choice and independence and helped her learn more about finances and budget and saving. And as Melanie said, which was a great point, you know, in order to do all the things that we want to do in our lives and pursue those goals that we have to have money. So what I'm going to do is share with you a little bit about Maryland Able. It's going to be, oops, there we go. All right. I don't know why that's going on here. Let's get out of here. Sorry about that. Let's pull this up here. Okay. Much better, much better. Yes. There we go. Okay, so Maryland Able is basically a way for people with disabilities to be able to save and invest money without losing really important benefits. So for many, many decades, there's been this real challenge for people that received SSI cash benefits and Medicaid and waiver services, which are all really important and things that help support us in your lives as you move forward. But there's this problem in that they limit you to being able to have just $2,000 in assets to plan and save for your future. And while $2,000 sounds like a lot of money, it really isn't a lot when you're thinking about all of the things that you want to do and accomplish in your life. It could be maybe getting your own car or moving out into an apartment of your own one day, or taking classes at the college. Whatever these things are, we need money for it. So we have to be able to plan and save for that. Well, thanks to a lot of advocacy efforts from people for many decades, and under the Obama administration in 2014, President Obama signed legislation that made it possible for people who were receiving SSI benefits and SSDI and people with disabilities to finally be able to save money and not have to worry about losing those critical benefits. Okay, so this was really a big deal, major legislation. So what it did is, instead of people just being able to save $2,000 or have $2,000, it made it possible for them to have up to $100,000. Now that's something that you could really plan for your future and pay for things over time. So that was the great thing, is that people and their families could plan for the future without losing those benefits. The other cool thing about the money that's in these savings accounts and investment accounts is you don't have to pay any taxes, not federal taxes or state taxes on those earnings. So it's a special tax advantage savings account specifically designed for people with disabilities to help them to be able to have a more financially stable future. People that contribute money to it, which can be anybody, it could be family and friends, it could be money that you make on your own. People are able to take an income deduction on their taxes And I know we're kind of like in that middle of that tax season right now. People are talking about it and how much we have to pay in taxes or how much money we're going to get back. So it's always a great thing to be able to save money and actually also have an income deduction. With ABLE accounts, you can access the accounts really easily online. They're super easy to enroll in. There's not a lot of paperwork to fill out. Everything is done online. So, oops, just wanted to tell you who could qualify for ABLE accounts. So like I said, these are special savings accounts just for a person with a disability. So you have to have a disability, and you had to have it by the time you were age 26. And the second thing is you have to have a disability that meets the Social Security's level of a disability. So we know if you're already receiving SSI or SSDI, we know that they've already looked at your documentation and found you to be eligible. But if not, you can always just download the disability certification form off of our website and take it to your doctor and have him or her fill that out, and that would be able to qualify for the account. Okay. It's important to know that the ABLE account is always owned by the person with the disability. So this is your account. It is your money. We believe that people with disabilities should be involved in making decisions about how their money is spent and learning about how to budget and save. Okay, so we also recognize that a lot of times we need support, right? So sometimes if you're under the age of 18, your parent is going to have to help you open the account and manage the account. But after you're 18, you could also ask for someone to continue to stay on and help you manage the account. We would just need to have consent to do that, but that's also available to you. So when you open an ABLE account, it just takes $25. It's like creating a savings account with $25, and then you decide how much money you want to put in to the ABLE account after that. You can, if you could put up to $15,000 a year in an ABLE account. That's our limit for the year. But for those of you who are working and have jobs, you can actually, if you wanted to, contribute above and beyond that. So that $15,000 that would go in the ABLE account could be from anyone. It could be from your family. It could be from stimulus payments. It could be from back payments that you get for benefits. And then for people who qualify for ABLE to work, they can contribute above and beyond that if they qualify. And these are for folks who have jobs and who are not contributing to a retirement account, or their employer is not. So there's opportunity to be able to do that. And remember, we talked about not having to worry about just staying within that $2,000 savings. ABLE accounts can have up to $100,000 in it, okay? I'm going to go ahead and make these slides available to you guys so you can read more about all of the things that I really am not able to cover in just a short period of time, but wanted to point out some really cool features. With an ABLE account, the money that's in your account, you can decide that you want to keep it in like a cash savings option. That's kind of like your regular savings account. Or if you want to, you can learn more about investing your money, where the money in the ABLE account, you can purchase investments in mutual funds that's managed by Vanguard. And we have a couple different options. So it's a good way to decide whether you want to keep it all in your cash savings, and you may want to put a little bit into investments, but you guys have options. And you can learn more about that on our website. Again, anyone can contribute to an ABLE account, anyone, family and friends, yourself. So there's lots of ways for people to be able to contribute. The money that's in the ABLE account, it has to be used for the person with a disability, but it can be used for anything that supports you in your health, in your independence, or in your quality of life. So what you're looking at on our slide right now, these are just the categories. It's not meant to be all the examples, but just some of the things you could use. Let's just look at the health, prevention, and wellness as an example. So this could be for doctor copays or prescriptions, but it could also be for a gym membership, because a gym membership helps us promote our health and stay healthy, right? All kinds of things. With assistive technology, that could be computers, but it could also be your cell phone. So there's lots of things in here that you could use your ABLE account for. Just remember that as long as you can answer the question, does this help me or support me in my health in my independence, or in my quality of life. That is how you would determine if it's qualified disability expense. With an ABLE account, there's no bank of Maryland ABLE, so you're going to link it with an existing bank account that you have. It could be a savings account or a checking account, or it could even be a bank account that your family member has if they're helping you with the account. But you're going to link it to the ABLE account, and then you do all of this online. We have some really cool features here in Maryland. We have a gifting page. So if you would like to use your gifting page for your ABLE account to save for a special goal, you can activate that page and then send a link to people through Facebook or email, or text it to them and just say, hey, I'm saving for a class at college. I was wondering if you'd like to support me in this, or I'm saving up to get my first car. You'd be surprised how many people use that gifting page. I like to share that we have over 3,000 ABLE account holders, and of the people that have activated that gifting page and have invited people to support them, together over the last 3 years, all the people have received over $1.8 million in gifts. So people do support when they find that there's an opportunity to support you in a goal. So that's an option. We have a prepaid card, which is a way to have the money from your ABLE account can be loaded onto a card, and you can use it in the community or in stores. So it gives you a way to be able to access the money in your ABLE account very conveniently. It keeps track of all of your purchases, so you'll know at the end of the month how much you spent in gas, or say in food or things like that. It has a really cool feature to tell you about where your money is going. This is something that doesn't automatically come with the ABLE account, but it's a really good tool to help us learn about spending and budgeting. So that costs an additional $1.25 a month if you choose to have that card. Okay. Let me just say a little bit about the stimulus payment for those of you who are receiving SSI cash benefits and who may have received a stimulus check of your own if you're over the age of 18. Okay. This sometimes has been causing people to go over that $2,000 limit. So you are able to, if you choose to put that $2,000 or whatever of it you haven't spent into an ABLE account, because once that money is in an ABLE account, it's what we call protected asset, and Social Security cannot count that as an asset against you. So it prevents you from losing your benefits. Okay. In order to have an ABLE account, there is an annual maintenance fee. It costs $35 for the year. You don't pay it all at once, but rather it comes out every 4 months at $8.75. Okay, and this is the fee that our program manager, the bank, charges us to run our website, to make sure that they transfer the money, make those deposits into your account, take the withdrawals out. That is the fee that we're charged for that service. In order to open an ABLE account, all you have to do is go to our website at www.marylandable.org. And once you're there, you can read our program disclosure book that tells you all about our program. You can look at the frequently asked questions, because there's lots of times people have similar questions. You can just look there and find the answers. And once you're there, you can, and if you decide to open an ABLE account, you'll see a little maroon color, like at the bottom left-hand side of the slide, you'll see a little button that says, let's go. You can open your ABLE account right from our website. It's just going to ask you some simple information like your social security number for yourself, and if you have an authorized legal representative, and what bank account you want to link it to. It's very easy. It's a series of questions that it prompts you through the process. And once you have the account set up, you can log on to it anytime. So if you needed to change your phone number or your address, or maybe you had your money in the cash savings option, and you and your parents talked about, maybe I'd like to try a little bit of investment, let me go in there and we can change that information. So where you can have some of your money in savings and some of it investments, you can manage it online anytime. Okay. And this is just an overview of all the different numbers that we've talked about. I'm not going to take my time to go through all of these, but this is kind of an at a glance thing to sort of remind you of some of the things we talked about if you want to go back and look at these slides. I want you guys to stay in contact with us. Let's stay connected. There's a couple ways we can do that. Please visit our website at www.marylandable.org, and that's where you have the frequently asked questions and whatnot. But there's also an events section that tells you about upcoming presentations where I'm able to go through this presentation, all the details, and explain everything to you. And they're free of charge, and we offer them throughout the year. So you can please join us for one of those if you want. Consider signing up for our newsletter. I promise you, I will not blow up your email. I promise you, I send out 4 a year, but lots of really good information about the ABLE program and how it can be used. And the other thing is, consider following us on Facebook. I try to post things a couple of times a week, if not every day, about things that help us to be more independent, that help build, that financial learning. We talk about benefits things. So lots of information that just impact benefits and savings and spending and planning for the future. And if you have any questions that you think of after this ends tonight, reach out to me at questions@marylandable.org. I'm also going to put my contact information into the chat feature, but that's just a Maryland Able in just a super brief overview. And I just hope that you guys will join me at one of our future presentations where we can talk more about it.
Thank you so much, Kelly. But Kelly, before you do anything else, can you, just to support our translators right now, can you in 60 seconds, just give us maybe 3 impactful tips about Maryland Able. Maryland Able does this, and the reason, 3 to 4 tips of why, because I know we were giving them a lot of information. And so
I'm sure I was talking really fast to try to fit it all in. But basically what I would say the most important thing to know about Maryland Able is that it's a way for people with disabilities to be able to save money and plan for the future without having to worry about losing those really important benefits like Social Security, SSI, cash benefits, or Medicaid, or other waiver services. Because outside of an ABLE account, if you ever have collectively anywhere altogether $2,000 or more, you are going to jeopardize those benefits. And with Maryland Able, you don't have to worry about staying under $2,000 in your planning and saving. You can actually plan for what you need to do and want to do, right? So that's the first thing. The second thing I would have to say is it gives families a way, parents a way to be able to plan for the future when they're not here anymore. We want to, as a parent myself, I want to be around for many decades to come, but one day when I'm not, I want to make sure that my daughter has money for what she's going to need to live on for the rest of her life, or that can help her with that. I also want to leave her with the knowledge and skills of understanding where her money comes from, how it's being spent, and participate in making those decisions. I mean, I want her one day to have a job and live and work in the community. And in order for her to do that, she's going to have an understanding of how money and savings and budgeting works. And Maryland Able is a good tool to help them with that. I would say that's probably the 2 biggest takeaways.
I think so too. And I like how this evening we're talking about assistance and identifying what benefits you are eligible for when you're 18. With the Benefits Enrollment Center, you get a resource guide that you walk away with. So even if you do have some benefits already in place, you can find out various benefits that you may be eligible for when your loved one turns 22 or turns 21. So I like the fact that we're talking about preventing us losing our benefits. We're talking about getting benefits and knowing what we're eligible for. We're talking about having fun and having a social life and having some money saved away so we can do the things that we want to do. And then we're talking about independence. How do I want to live on my own one day? And who can support me in that efforts as I leave school? I'm leaving entitlement and going into the eligibility world. And it's a whole different world. They are two different worlds, and it's very complex. So I appreciate you, Kelly, coming to share this. We will always have you back. You can never get this information on 1, 2, 3, 4 times. I've heard it probably 9 times. And I seem to learn something new each time. And things are always evolving. And new things are always happening with the Maryland Able, like everything else. But every year there's something new, and it's enhanced. Like since the program first started, you guys have really added some enhancements to it. So thank you again. And you're going to put your information in the chat box, right?
I'm gonna put it in the chat box. Yes, I am. And I'm going to stick around and learn more myself. And
Yes.
I already learned a lot from Kelvin and Sandy and Laquana. And I want to learn more. And I think that's the most important thing we can do is keep learning and keep arming ourselves with the resources we need to pursue our goals and our dreams for the future. So thank you, Melanie. I'm going to go ahead and sign off my screen now and hand it back over.
All
Oops.
right.
If I can
All
figure
right.
out how to get it there. There it is. Okay.
Right. I want everybody to check out the chat box. Peggy just put in the TY Fair website. So I'm assuming that Peggy, all of the resources tonight that's being displayed will be up on the website for everybody.
That's correct. All of the presentations as well as the PowerPoint slide deck will be uploaded to the TY Fair site by Monday.
Gotcha.
So everyone can go back and at their own pace, get the information they need, the contact information.
Awesome. Awesome. So we are so excited, super excited to have Diana Ballara from our Social Security Administration Office. Diana is the public affairs specialist, I believe, for our area. And so she is on the telephone, I believe, and we're going to put up her PowerPoint. And so Diana, do you hear me? Let's see if she can hear me. And Peggy is putting up, sharing the screen. And Diana, if you can unmute, because we are super excited to have you here to share what people need to know about this.
Can you hear me?
Yes, yes.
Awesome. Okay, perfect.
Perfect.
Thank you so
I was
much.
just introducing you. Oh my goodness.
I've been on the line all this time, so I'm very excited about it too. And it was great to hear from the other speakers.
We are grateful for you coming this evening to share information. And we have the rest of the evening is yours. We have 28 more minutes. And if people have questions, they can put it in the chat box. But we really want to give you the opportunity, Diana, to share the importance of what Social Security Administration has for those who have a disability, starting at the age of 18 and transitioning.
Thank you very much. Thank you.
Right.
And do you have the presentation up already? Can everybody see it?
It is loading, and your first slide is saying Social Security disclaimer.
Absolutely, because I would like to just tell everybody that if I mention any amount, this will only apply for the year 2021. Okay. If you can advance to the next slide, please.
Okay.
And on behalf of the Social Security Administration, first of all, I would like to say thank you, Melanie, and the entire team at the ARC of Prince George's County, as well as Prince George's County Public Schools for inviting us. I am very happy to participate at this program, and I will be providing information about Social Security, disability insurance, and supplemental security income. In the next slide, also on behalf of all of us at Social Security, we wish that you and your families stay safe and well during this health crisis. We are almost at the end of the tunnel, right? There is light at the end, and we are almost at the end of the tunnel. So hopefully next time that we meet, it's going to be in person. Also, on behalf of all of us at Social Security, you mentioned, Melanie, what can you say in 60 seconds? What message can I give you in 60 seconds? I will tell you that all you need to learn about Social Security is online. Visit us online, socialsecurity.gov. And especially during this health crisis, when our offices are open. But it is a little bit different than what it was a year and 2 months ago, because our offices are only open for critical cases, emergency situations. That is the reason why I invite you to visit us online, because all the information that you need to know about your benefits and your children's benefits is available at socialsecurity.gov. If you cannot answer your questions, or if you cannot conduct your business with us online, give us a call, please. Our offices are open Monday through Friday. Our representatives are ready to help you by phone. And please take a piece of pen and a pencil to write down the contact office for Prince George's County. We have 2 offices. Camp Springs office, the service down Prince George's County. Their phone number is 877-512-3849. And we have the Greenbelt office, which services North Prince George's County. Their phone number is 866-338-4115. So that is my 60 seconds, all you need to know about Social Security for now. But nonetheless, I'm not leaving yet. Next slide, please. Let me talk a little bit about the 2 disability programs that we have. I have a comparison chart that tells you the 2 disability programs that we have. Towards your left, you see Social Security Disability Insurance. That is a program like for you or for me, parents, workers, people who pay into the Social Security system. If we become disabled, that is the program that will get benefits because it's based on our contributions into the system. The payments are based on the earnings that we had. This is actually a family protection plan because if a worker becomes disabled, there is also the possibility that family members can get benefits under the worker's record. And also it is important to mention that if a worker becomes disabled, there are medical benefits through Medicare. The benefits and the program information that you see towards your right is supplemental security income. It is a program based on the need. We pay benefits to people who are 65 years and older or people who are of any age but are disabled. And the SSI program, we call it SSI for short, has nothing to do with people working and paying into the system. It is a program funded through general revenue, and that is the program that you might be most interested because it's the program that will allow Social Security to pay benefits to children with disabilities. Next slide, please. Once again, SSI, the requirements are you are 65 or older, or you are any age but disabled. But the other features of the program, the other requirements of the program is that you have lower income and resources, and of course, in regards to children, there are specific rules because income and resources of the parents are counted for a child to be eligible to SSI. For SSI, the person must be a U.S. citizen, and we are also going to take a look into the family composition, into the living arrangements to determine if a person can apply, can actually receive benefits from SSI. In the next slide, there are special qualifications for people who are not citizens. And basically for a person that was living in the United States before August 22nd, 1996, they can qualify if they are not citizens, if they were in legal status in the country. But it is true that there are also some exceptions to that rule, and also there are some other qualified non-citizens that could be eligible for SSI. And what I will encourage you, if you are on the call, and if your child is not a citizen because your child was born outside the country, please contact us so we can determine if your child could qualify or not. Next slide, we'll talk a little bit about what do we mean by income, resources, and also living arrangements, because those are three main components in terms of eligibility to SSI. Income is going to be money, not the child's money from wages, but the parents' wages will count when we talk about children. Also, any other pensions, any other income that the family receives. And we can also include food and shelter that is given to a child or to a person that is an adult. In terms of the resources, is the things that people own. Houses, not the house where the family or the person lives, but if the person has a second home or if the family has a second home. Bank accounts, Kelly mentioned in regards to the resource of $2,000. Does the person, the applicant, has $2,000 in the bank or other resources that will equal $2,000? For couples, it is $3,000. So, and remember that I said that for children, we will count income and resources of the parents. So we will take a look into stocks, bonds that the parents have. In regards to where the person lives, we talk about living arrangements. Does the person live in their own household, or so they live in somebody else's household, and that person is providing food and shelter? We give that a value. It is usually 1/3 of the total amount of the SSI federal rate. And by the way, this year, the top amount of SSI payments that a person can receive is $794. That is the top amount. that a person who receives SSI can get. In the next slide, some of the requirements in regards to children. We will talk about SSI, and it is important to determine children who can receive SSI. And these are a person under the age of 18 that has a physical, mental, emotional impairment that results in severe limitation of function. The disability concept for the Social Security Administration when it comes to children, we're going to measure development. Is the child developing at a normal rate? If we compare with children that are the same age group but do not have the medical condition or the physical impairment. Also, we are going to say that that condition must be a permanent condition, or it's a condition that is going to last more than 12 months. Those are the main eligibility criteria in regards to what is disability for a child in terms of Social Security. In the next slide, you will see a little bit more of other eligibility criteria. We talk a little bit about income, resources, living arrangements. Next slide talks about deeming, which is whatever the parents own, whatever the parents' resources and income will be counted against eligibility to a child's benefits in terms of SSI. In regards to when to apply or how to apply for SSI, in the next slide you will see that for an adult, the adult can complete an application online if the person is between age 18 and 65. And the person has never filed, is a U.S. citizen, never been married. In the next slide, for a child under the age of 18, we will request that you give us a call. You can call our toll-free number, or you can call your local office, the office's number that I gave you before for Prince George's County offices, or call the toll-free number and schedule an appointment. You can still be able to complete a disability report online. In the next slide, requirements for disability benefits for adults, not just SSI, but when a worker becomes disabled. And it's important to mention that for workers, if you have a child with a disability, it's important that you know that if anything happens to you as a parent, we provide benefits to family members of a worker that becomes disabled. And of course, you must work, pay into the Social Security system to be eligible to disability benefits on the Social Security. In the next slide, we find the definition of disability for an adult, which is the person has a medical condition, prevents the person from working. The condition will last at least 12 months, or is a permanent condition that is known to get any better, might result in the person's death. Next slide, when should a person apply for disability benefits, either under Social Security or SSI? I will say that for as soon as the person meets the minimum eligibility criteria, which is, once again, for an adult, medical condition that prevents the person from working, for a child, a medical condition that stops normal development. That is the minimum criteria, and of course that the condition is going to last more than 12 months. Once a person applies for disability, in the next slide, you will see once again how to apply. Either go online or call the toll-free number to schedule an appointment. In the next slide, you will see what happens next after Social Security Administration takes an application. We take an application and we also make sure, Social Security is responsible to make sure that the person has an application filed with us and also has completed a disability report and has given the agency authorization to consent for release of information. Once we have all of that information together, we are going to forward the claim to a state agency called the Disability Determination Services. They are a state agency, and they are actually the ones that make a medical decision. In the next slide, you will see the steps that they will take on how they will determine if the person is disabled or not under Social Security laws. Once a decision is made and it's either an approval, then we start paying benefits to the person. If that is a denial, then we are going to, the person has appeal rights. If we deny a claim, you can appeal with us. In the next slide, you will see that there are family benefits. We can pay benefits to spouses, to children. Next slide, for children. Family members of a worker that is either retired, disabled, or deceased. Next slide, you will see a little bit more of information in the appeals process. If we deny a claim or we deny benefits, we deny an application, the person has the right to appeal. Next slide, please. There are some issues that you have to report to the Social Security Administration. If you are convicted of a crime, if you violated parole or probation, those are some of the things that you have to report to us, even before we send your claim to the Disability Determination Services. Next slide, there are some report and responsibilities. Everybody that applies for Social Security benefits has to report any changes, and that is especially important when you're applying for SSI, because that program, we still have to take a look at income resources, living arrangements to determine eligibility. Next slide. Once a child is approved to receive benefits and the child is under the age of 18, at the age of 18, we are going to conduct a redetermination. We are going to evaluate if the disability is meeting all of the requirements for adult disability. After the age of 18, we have to reevaluate if a child was receiving benefits at an earlier age. Next slide, I'm going to stop there because I would like to know if we have any questions in the chat, or also if anybody would like to ask any questions. And by the way, I understand that this has been recorded, so you should be able to take a look at the presentation, but also it can be shared by email to all of you. Any questions, Melanie?
Right. Let me check the chat box of any questions, but I really like that last slide when you talked about people can apply as early as their 18th, on their 18th birthday. Is that correct?
Well, actually, anybody can apply for SSI because SSI is a program that pays benefits to people who have never worked, people who are 65, blind, disabled at any age. And sometimes what happens, Melanie, because remember that I keep saying that in regards to SSI, the income and resources of parents will be used for eligibility purposes. And a lot of times, children do not qualify because parents work and parents have income and resources. But that is under the age of 18. Once the child turns age 18, then the income and resources of the parents will not count against eligibility for children.
Gotcha.
The child can still be living at home for as long as the child is after the age of 18, older than age 18. Then it doesn't matter that they still live at home. It doesn't matter that the parents have income and resources. We will not count those. And that is, in my experience working in the community, I've seen this a lot. Parents apply for benefits when the child is under the age of 18. Benefits are denied because of parents' income and resources, the family's income and resources. And then the parents don't apply once the child turns age 18. Very, very important to apply for a couple of reasons. Number one reason is because if the child receives SSI benefits after the age of 18, that is income and resources that you can use to take care of the child.
Definitely.
And second, because Social Security, one of the benefits that we provide for the children of workers is disabled adult child benefits. Disabled adult child benefits. So we can pay benefits to a child, it doesn't matter the age, for as long as the child became disabled before the age of 22. That is the reason why it's so important to apply for those benefits, because if anything happens to the parents, we already know that the child became disabled before the age of 22.
Oh, okay. Oh, thank you. Everybody's saying this was so informative. They say thanks a million, very informative. Okay, Trina wanted to know, what do you have to provide to confirm the child over 18, what is their disability? So documentation, can you talk a little bit about how would somebody, what documentation do they need to bring when they are applying?
Absolutely. At the time of application, you will have to complete an application per se. We also have to complete a disability report. Disability report captures all the medical data, the diagnosis, prognosis, any medications, any tests, results, EIPs from school. It's going to capture all of that information. You don't physically have to have these documents because you sign a release. We will gather those documents from the facilities that you mentioned in the disability report. Of course, if you have hard copies of those, please, you will be able to forward those to the local office. But the most important thing is to have the names and names, addresses, phone numbers of the places where your child has been treated for the medical condition, or if that is just the school, for example, a school has medical records and EIPs and psychological texts, intelligence tests, different things like that. That is exactly what we need, documentation. And most of that will be captured in the disability report that you have to complete. If you have the hard copies, as I said, it's great. But if you don't have them, let not delay your application because you don't have hard copies of medical records, for example, for as long as you give us the information on where we can get those medical records and you give us the consent.
Okay, so they should have like the doctor's information, address, telephone number to add to that application.
Exactly.
Okay.
Exactly. And that information has to be complete. If you have business cards of the doctors where your child has been seen, that is what you need to use. It is very useful if you have tests, what kind of test, when the test was performed, what were the test results. If your child takes medications, list all the medications. Does the medication causes any side effects? List all of that too. In the disability report, please use the section that is in remarks, because in the disability report, you are going to complete that report. You're going to tell us what is the diagnosis, but also you need to let us know what are the limitations that your child has because of that medical condition. And be very specific. Be very specific. For example, if your child is in pain, your child has a physical impairment, and it's in pain all the time. Is the pain all the time? It is sometimes. It is just when the child is walking or when the child is sitting. Does the child take medication for the pain? Use all the information that you can give us on how a medical condition really impacts the ability for development. That is what we use, the criteria we use for a child, or if that is an adult, how the medical condition impacts the ability to work.
Okay. Okay. Thank you for sharing that information, because a lot of people don't realize that when they go to apply, the more detailed information on all the providers and the medication and the tests, if you have that, it really is helpful when you are applying for SSI. People don't realize that, but have all the medical records. Hopefully everybody has a medical transition binder, and it has all the summary of visits and going back from when the child was young. It does help when you're applying to be able to give the doctor's information and the medication and testing. So that's a good point, Diana. I know it's 8 o'clock, but we have one more question and then we can close out. We have Ms. Jones ask if I have already applied but was denied based on my income. When I reapply for my daughter, will it still be on file? That is the question.
Yeah. Okay. And once again, remember, you apply for your child. I am assuming your child, when you apply, your child was under the age of 18.
Mm-hmm.
If the child is still under the age of 18 and the income and resources of the family have not changed, you have the right to apply. You have the right to appeal. But since the condition why we deny is the same, we will probably not grant an appeal. Now, once your child turns age 18, it will not matter what your income and resources are. And that is the time in which you should apply again. And it's going to be like a brand new, it is going to be a new application. You have to go through the entire process.
Okay. Okay. So should we start anew, fresh?
Absolutely.
Okay.
In regards to the appeal, I will say that in this case, Ms. Jones mentions that is because of her income and resources. If she appeals, yet the child is under the age of 18 and the income and resources of the family have not changed, it's the same, why appeal? We will definitely deny again because nothing has changed. The basis of the denial is still there, nothing has changed. And that's what I said. It is important when you apply, for example, and we deny a claim, take a look at the reason why we are denying. And an appeal will be for you to give us proofs, for you to submit documentation to prove that we are wrong, that we made an incorrect decision.
Okay, and this is for her when she turned 18. She said, thank you so much. It does, this is gonna, she wanted to know when your daughter turns 18, would it still be on file? But you saying it starts fresh, new.
She has to complete a new application.
New, right. And sometimes people think that, when you're doing it, they'll remember that I was denied 5 years ago. So that's kind of like, I think that's what she was thinking about. But you're saying it's new, fresh, because now her daughter
it has to be a new application.
Right, because when you turn 18, you consider a household of one. So,
once the child turns 18, okay, now it's considered an adult.
Right.
And we will only count, for exercise purposes, we will only count income and resources on the child's name. We will not count the parent's income and resources.
Gotcha.
And typically, that's usually what happens when parents with children with disabilities apply. Parents' income and resources are too high, and therefore we know that the child cannot get benefits because of parents' income and resources. And that is when the children are under the age of 18. But once the child turns age 18, it doesn't matter income and resources for the parents.
Awesome. Thank you so much. This was so helpful. We are so delighted that you was able to come on with us and share. We know that you will be back. We're going to have you come back because we can never get enough information on how to apply for SSI. And if we have any other barriers or challenges, we're so glad that you are our partner. And so I'd like to thank all of our presenters tonight, Marilyn Abel, Kelly Nelson, the Benefits Enrollment Specialist, LaQuana Simmons, Independence Now, Youth Independent Specialist, Calvin Hawkins, Maryland Park and Planning, Sandy Kelstrom. She's a Therapeutic Recreation Coordinator. And definitely, again, a special thanks to Diana Valara from the Social Security Administration. Peggy, I'm going to turn it over to you because you are the transition specialist for Prince George's County Public Schools. And I think tonight you did a great job of letting us talk about a coordinated set of activities that's going to move our youth from school to post-school, but also having positive post-school outcomes. So this has been a pleasure to kind of host this tonight. So thank you. And I'm going to hand it over to.
Great. Well, thank you. A huge thank you to Miss Melanie Clark for a fabulous job, bringing together all of these valuable resources and for doing such a fabulous job coordinating and facilitating our evening. And I agree, this information is so beneficial. It will really impact our youth as they transition into the adult world. So we are already thinking of having a lot of the panelists be able to join us and present to our school-based transition coordinators. We have a group of about 40 that we think might also benefit from hearing all of this very valuable information from the experts that are actually in the field, answering the questions, dealing with students and families. So thank you again, fabulous panel. Thank you, Ms. Clark, fabulous moderator. Just in case you missed it, we will be posting this recording and our 3 previous webinars, the last 3 Wednesdays, on the TY website, TY Fair website. It is here at the bottom of the slide, tinyurl.com/PGCPS TY Fair. This recording and these slide decks will be posted by Monday. And we would just like to, again, thank all of the families for joining us this evening. This is a collaborative effort from Prince George's County Public Schools, Prince George's County Provider Council, and we are delighted to be able to collaborate with them and bring you this valuable information. So from all of us, we will say have a wonderful evening and good night.
Good night and thank you.
Night.
Thank
Be
you.
safe.
Thank you, everyone.
Thank you, everybody.
Good night.
Thank you.